The state of Britain's National Health Service has become a key battleground in the most unpredictable UK general election in decades. Research for the Financial Times by the Health Foundation, an independent think tank, has shown that the NHS became markedly less efficient from 2012 as staff poured their energies into preparing for a big structural shake-up the following year. And a care scandal led hospitals to hire more temporary nurses at higher cost to counter safety concerns. As the NHS grapples with an estimated £30 billion financial shortfall, politicians and policymakers alike point to Salford Royal in the north of England as an example of what the health service can still achieve at its best. The focus is on getting the most out of employees in order to secure what Sir David Dalton, Chief Executive, calls their discretionary effort on behalf of patients.
We don't tell people what it is they must do. We don't performance manage solutions into the organisation. We engage staff, we involve them, we support them in offering their ideas for change. The leadership of the organisation is also very visible, so I spend my time, and so do all of my colleagues, working alongside others for a minimum of half a day a month. Last month, I worked for 3 days alongside members of staff in the hospital, in the community, shadowing what they were doing, putting on a uniform and being on the wards or whichever department it would be.
Outside each ward, a board carries information that patients and their families need to know to judge how well the hospital is performing and how to hold staff to account.
The Patient Focus Board gives key things that patients and relatives wanted to know when they walk on the ward. So infection control rates, falls, and key messages, how to get hold of us, that kind of thing. The board in here is about quality. So it's about giving the staff information about how we're performing, keeping them up to date with what's happening on the unit, the safety issues on the ward, as well as manager training, infection control, key things that we feel they need to be aware of to be able to function and to be part of the team, to be part of the organisation. The goals and objectives of the hospital are linked to their goals and objectives. So them understanding where we are and how we're doing and ways that we need to improve actually helps them to perform and to achieve the goals of the organisation as well.
Elements of staff pay are also tied to performance, very rare in the NHS, and an approach that, so far, politicians have shied away from attempting to impose nationwide. In general, staff at Salford have accepted this as a spur to keeping training up to date.
Gone are the days where I was nagging people to go and attend this training. Now they're knocking on my door and they want to attend it.
However, the Health Foundation's data analysis shows how far the NHS as a whole still has to go.
The NHS did quite well in the first 2 years of this Parliament in improving its productivity and balancing its books. Over the last 2 years, productivity actually appears to have declined, and to have declined by around 1% a year.
Sir David, however, believes safety and productivity go hand in hand.
High quality care and safe care is cheaper than care that's of poor quality and unsafe, because we know that patients who have an infection or a pressure ulcer or whatever it might be stay in hospital longer to recover from those harmful events. So we know that if we can reduce harmful events in the organisation, we can treat more patients through the same number of beds, so it improves our productivity.
As the NHS grapples with the biggest financial squeeze in its history, hospitals are going to have to become more efficient and productive places. That will entail more Salfords. That is, if health managers have the skills and politicians the will to follow its example. This is Sarah Neville for the Financial Times at Salford Royal in Greater Manchester.